Regional health authorities are directed not to add extra control measures without permission during the Spring Festival period. State authorities have rolled out 6 prohibitions, which are applicable in all provincial level regions except Beijing. Local authorities cannot issue a blanket ban on people from outside returning to their hometowns, nor can they impose any quarantine on arrivals. They cannot tax members of non-designated groups who travel between provinces from low-risk areas to urban areas, or those who travel from low-risk areas in province. Health monitoring at home for those traveling within their province is banned, as is arbitrarily extending home monitoring. To discuss this, I'm now joined by Naijun. He is an associate professor from the School of Public Policy and Management at University of Chinese Academy of Sciences. Professor Hu, welcome to the program. I want to first talk to you about those 6 prohibitions. They're now in place to make sure that people could travel safely and with as much convenience as possible under current circumstances, should they choose to travel during the upcoming Spring Festival. What do you make of the rationale behind those 6 rules?
Yes, I think we have to face the dilemmas. We are going to celebrate our Spring Festival, and at the same time, we also have to make sure that the prevention and control will take place. So I think the most important thing, in my opinion, in this new round of prevention and control is scientific and precise. That is to say, we do not have to be panicked because our newly founded case is only a few every day, and I don't think there is mass infection in China. So I think we should focus our measures on the key person, on the key area, on the key cases. Now that is why I think there are, as you have mentioned, the 6 prohibitions, which means the prevention and control. Yes, we have to do it, but we have to do it in the minimum cost and to make sure our people are sacrificing their minimum preferences and benefits. That is why we call this scientific and precise.
Professor, we've had separate incidents before locally where local authorities issued added epidemic prevention measures to travelers. So if a person is slapped with an arbitrary order, like extended home health monitoring, what could they do?
Well, I think the most important thing, in my opinion, is also from the law and the regulation system itself. That is to say, the local authorities and the government must pay attention to the spirit of the 6 prohibitions as we have talked about. But I think as to specific person, if they are in this kind of dilemma, I think at least there are 2 things they can do. The first thing is that they have to call their local authorities before they go back. They must be clear of all the details of the local policies before they make any plan of traveling. And the second thing I think is also there are some platforms on which any extra measures can be taken photo and to exhibit to all the people. I think the central government and the supervisor bodies will have a supervision of all the local authorities' behaviors and policies. I think in the world, that is to say, we have to make fully preparations, and all the levels of supervision bodies must make sure that they are helping the people to get home safely and healthily.
Professor Naijun, appreciate your analysis. Thank you for making time for us today.